as it relates to cardiology?
Yes, and this is the most massive and most expensive cardiology research study ever done on the core issue, what you just mentioned, 2 million procedures a year in the United States that cost us $50 billion, and that do cause some people to have strokes, infections, and even die. These are big procedures, bypass and stents. So our government and other governments around the world took 5,179 patients with stable ischemic heart disease. They got that awful feeling called angina pain most of the time. Then they did a stress test, and they did poorly on their stress test. Some of them had a CAT scan that actually identified how badly blocked their arteries were. And some very bold patients and researchers said, all patients will learn about diet, exercise, and get on really good medication like little old aspirin and other prescription drugs. Half are going to go straight for the catheterization, and based on that, 80% of those had a stent or open heart surgery. The brave 50% were left on medication, diet, exercise, cardiac rehab, and over the course of 4 years, they looked at what happened. So that was the setup of the study.
So what happened to the folks that did not get the stent or the bypass surgery when normally they would have?
Yeah, actually, at 1 year after they were randomized, there were fewer strokes, heart attacks, and death if you got the pills, the diet, and the fitness program compared to the big procedures that are, quote, curative, but we learned maybe not. At the end of 4 years, the death rate was equal. If you kept having angina pain after you were randomized, you did have less symptoms if you had the stent or the bypass. Many of the people in the study, though, had very little chest pain before, and the bottom line was, if you have blockage but no symptoms and you fit the criteria, you had absolutely no advantage going through your chest getting cracked or a stent being placed from your leg or your wrist. There was no advantage for quality of life or pain. If there was a lot of angina, you could argue will make their quality of life better, and that's a judgment between a patient. But this is radical and revolutionary, not for the person in the emergency room or the coronary care unit on the verge of a heart attack and truly unstable, because this was stable patients. They were allowed to go home and think about all this. And I have a rule: if you're allowed to go home, you need to really consider if you need these operations at all. Get with somebody who can give you the full story, the ischemia trial results.
And to be clear, just for people watching, this study did look at patients who were not dealing with heart attacks or had dealt with heart attacks in the past. That's what Dr. Khan is referring to when he says stable angina, chest pain that, again, not coming from an actual heart attack. But having said that, Dr. Makary, when a study like this comes out, I'm going to ask you, Dr. Makary, is it even ethical to perform, say, bypass surgery or put stents in a patient who Dr. Khan just told me will probably do better without?
Mm-hmm. Well, let's be honest. The vast majority of people who have stents placed believe that they will live longer, even though the evidence shows very clearly that outside of an active heart attack, there is zero survival benefit. From all the experts, all the studies, it is now very clear. We used to think that so-called opening up the blockage meant you were automatically going to live longer. That was the old thinking. We now know the studies have shown no survival benefit. So I'll tell you, the doctors need to talk about that study. They need to talk about the long term. This idea of using language that's loaded, like, oh, you have a blockage and we're going to open it up. Well, you know what? Stents have their own complications. There's something called in-stent stenosis, where clots form inside the metal cage. Patients should know that ultimately, in the end, the benefit of these surgical interventions is to reduce the pain of angina or eliminate it, or it's for an active heart attack. Outside of that, if you're, as Dr. Khan said, stable, healthy, and you have no active chest pain, no angina, you're not going to live longer for a stent. I asked one of our heart surgeons, what percent of patients who get stents believe that they are going to live longer? He said 100%, because the doctors are not telling them what they should be telling them about the survival implications.
And this is the power of suggestion, of course, and also when patients talk to other family members and they have the same experience, at least in terms of their perception of what's going to benefit them. Yet this study has the potential to impact so many, because more than 9.5 million people suffer with this condition in the U.S. alone. And I know that the profitability is still a factor here because when stents are put in, Medicare reimburses over $10,000 per procedure. And so is that the issue here?
Yeah, it will